So that brings us to our third goal, which is removing excess skin. And this is what a lot of people think of when they think of tummy tuck, is removing skin. So the same factors that cause fascial laxity can also damage the elastic properties of the skin, which means it doesn't bounce back as easily as it did years before. Those factors can be pregnancy, significant fluctuations in weight, even prior surgeries, C-sections and things like that can damage the skin and cause contour irregularities that we address during the course of a tummy tuck. C-section scars especially can cause tethering down on the bottom portion of the abdomen just above the pubic bone, which makes the skin excess appear worse. And this is what I hear a lot of women when we're discussing abdominoplasty surgery in the office talk about having a flap or a little shelf in their lower abdomen that just drives them crazy because they can't get rid of it. And that goes away with an abdominoplasty surgery. We remove that old C-section scar, we remove the extra skin and pull the rest of the skin tight and really help to reshape the lower abdomen and remove the skin excess that people find unattractive. Now, it should be noted that there is some skin excess that can be hidden. In the front part of the abdomen where C-section scars are, there are connections between the skin and the muscle covering or fascia, which cause transverse bands. You know, there's one right above your belly button. There's one typically at your lower abdomen, just above your pubic bone. So the skin, as it gets loose, kind of stops there and creates the rolls that people complain about over time. On the lateral or outer part of your abdomen, those tight fascial connections between the skin and the fascia don't exist. And so there can be a lot of skin excess in the hip region or in the lower back, which doesn't really show itself until you start pulling on other areas. And during the course of our examination, I assess for that laxity because sometimes taking our abdominoplasty incision out further on the sides than we normally would can really significantly improve contour in those areas where you really didn't see a problem initially, but would if we don't do the right surgery and remove some of that extra skin. A lot of times, when people have realized that and come in complaining about it, they say, look, it looks like my thighs or my butt is just melting into my legs. That's what is responsible for that. And in an abdominoplasty, we can address some of that by just carrying that incision out a little further. All right, so now that we've talked about the goals of the surgery, let's talk about how to actually do a tummy tuck and what goes into a tummy tuck procedure. So first of all, the surgery takes approximately 3 hours, but is really variable depending on the patients. Now, it's very common to add on breast rejuvenation to a tummy tuck surgery, that being either a breast augmentation or a breast lift with augmentation. This is what's known as the mommy makeover. That can push surgery times to 4, 5, and even 6 hours in length. Now, those are long operations, but you've got to remember that this is outpatient surgery. So no overnight stay is required. The way that we do anesthesia is very conducive to patients going home. You recover well in your own bed, in your own house, much better than you would with an overnight stay in the hospital. And again, we kind of talked about at the very beginning, making this as safe as possible. If you need to be in a hospital for elective cosmetic surgery, that's something that we really have to talk about during the consultation process to make sure that the surgery is as safe as it can be. So the incision, like we've discussed earlier when talking about removing skin excess, is hidden in the bikini line. I have my patients bring either a swimsuit or a pair of underwear that they want to hide an incision in with them when they come to the surgery center on the morning of surgery. And we actually sketch out where that swimsuit hits their skin so that I can plan where that incision is going to fall at the end of surgery and try and land that incision within an article of clothes that you would like to wear after surgery so you can't see it. The procedure itself starts with the anesthetic. Over the course of 2021, I have drastically changed the way that anesthetics for my tummy tucks are performed in that I have gotten to where a TAP, that's TAP block, is a routine addition to every tummy tuck surgery. So what this is regional anesthesia. So I have a portable ultrasound machine that plugs into an iPad that in the operating room, after you're asleep, before anything is even done, we use that ultrasound to find where the nerves that give you sensation to your abdominal muscles, to the skin of your abdomen, come out between the muscles of your side. And then while we're looking at it with an ultrasound, put a needle and flood that area with local anesthetic. This accomplishes a couple of different things. First, it causes the